Hi, I'm Dr. Caleb Sterling, and today we're talking about something that affects millions of people worldwide, something you might not even realize is happening right now in your body. We're diving deep into the silent symptoms of heart disease. And I'm calling them silent because here's the thing, most people don't recognize these warning signs until it's almost too late. Heart disease isn't always dramatic. You don't always get that sudden crushing chest pain you see in the movies. Sometimes it sneaks up on you so quietly that you chalk it up to getting older, being tired, or just having a stressful week. But your heart is trying to tell you something, and I want you to understand what to listen for. Let me start by painting a picture. Imagine Sarah. She's 52 years old, she exercises twice a week, she's not overweight, and she's never had any major health issues. About 6 months ago, she started noticing something unusual. When she went for her regular jog, she felt this weird sensation. Not quite pain, more like a heaviness in her chest. It would go away after she rested for a few minutes, so she thought nothing of it. A few weeks later, she was playing with her grandkids and felt inexplicably exhausted, like absolutely drained. She went to bed at 8 p.m. thinking she was just tired. Sound familiar? This is what I want you to understand today. These aren't dramatic symptoms. These are the silent whispers of a heart that's struggling. Now, before we dive in, I need to give you the important disclaimer. I'm sharing this information for educational purposes. If you're experiencing any of the symptoms I'm about to describe, please see your doctor right away. This isn't a substitute for medical advice, diagnosis, or treatment. Always consult with a healthcare professional if you have concerns about your health. Let's talk about what's actually happening in your heart. Your heart is essentially a pump. It's a muscular organ that beats about 100,000 times a day, pumping blood throughout your entire body. That blood carries oxygen and nutrients to every single cell you have. When you have heart disease, what's usually happening is that your arteries, the vessels that supply blood to your heart muscle, are becoming narrower. This is called atherosclerosis. Plaque builds up on the walls of these arteries, restricting blood flow. And here's the key thing. This process can happen for years, sometimes decades, without you noticing anything obvious. The reason the symptoms are silent is because your heart is incredibly adaptable. It compensates. It works harder to get blood where it needs to go. Your body is amazing at adapting to stress, and it does this silently in the background. Until one day, the compensation isn't enough anymore, and that's when you start noticing something is off. But by that point, significant disease may have already developed. So let's get into the specific symptoms that many people miss. The first one I want to talk about is unusual fatigue. And I'm not talking about being tired because you worked a long day or didn't sleep well. I'm talking about a deep, bone-weary exhaustion that doesn't make sense. You wake up after a full night's sleep and you still feel drained. Walking up the stairs feels like climbing a mountain. Playing with your kids or grandkids wipes you out. You might blame it on getting older, and sure, age is a factor, but persistent, unexplained fatigue can be a massive red flag for heart disease, especially in women. In fact, let me talk specifically about women for a moment, because the symptoms can be quite different from what men experience. Women often report fatigue, shortness of breath, and jaw or back pain as their primary heart disease symptoms. Men are more likely to have the classic chest pain, but this means that women often go misdiagnosed, or their symptoms are written off as something else entirely. If you're a woman and you're experiencing new, unusual fatigue, please talk to your doctor about it. Make them take it seriously. The second silent symptom I want to discuss is shortness of breath. Now, you expect to be a little short of breath when you exercise, right? But I'm talking about shortness of breath that happens when it shouldn't. You're walking slowly through the grocery store, and you feel like you need to catch your breath. You're having a casual conversation with a friend, and you notice you're breathing heavier than normal. You're getting ready for the day, and you're winded just from getting dressed. This is your heart saying, hey, I'm not moving blood as efficiently as I should be. Your lungs aren't getting adequate oxygenation, and your body is struggling. Here's something important. Shortness of breath can also happen when you're lying down. You might notice that you can't lie flat comfortably anymore. You need extra pillows to prop yourself up. You might wake up in the middle of the night gasping for air. This symptom deserves attention because it often indicates that your heart isn't pumping blood back from your lungs as effectively as it should. The third symptom I see people ignore is dizziness or lightheadedness. You stand up from your chair and the world spins a little. You feel faint. Your vision gets a little fuzzy. You might chalk this up to standing up too quickly or not drinking enough water. But persistent dizziness can indicate that your heart isn't pumping enough oxygenated blood to your brain. This is serious. This needs to be investigated by a medical professional. Chest discomfort is another one, but here's where it gets tricky. I said chest discomfort, not necessarily pain, because many people experience something that isn't quite pain. It's a pressure, it's a tightness, it's an ache. It's heaviness. Some people describe it as someone sitting on their chest. It might come and go. It might happen during exercise or emotional stress, and then disappear when you rest. You might think it's indigestion or muscle soreness, but chest discomfort, regardless of how you describe it, needs to be taken seriously. And chest discomfort can also radiate. It might travel to your arm, usually the left arm, but sometimes the right. It might go to your neck, your jaw, or your back. It might feel like your whole upper body is uncomfortable. Again, this is your heart trying to communicate. Let me talk about another symptom that often gets dismissed: cold sweats. Not the kind of sweating you get from being hot or exercising. I'm talking about breaking out in a cold sweat when you're not doing anything physically demanding. You're just sitting at your desk and suddenly you're sweating. Your palms are clammy, you feel clammy all over. You're cold but you're sweating. This is a symptom that shouldn't be ignored. Palpitations are something else I want to address. These are moments when you become very aware of your heartbeat. You might feel like your heart is skipping a beat, or racing, or beating irregularly. You might feel a flutter in your chest. You notice it because it's unusual and uncomfortable. Most palpitations aren't dangerous, but they can be a sign that something is wrong with your heart's electrical system or with your heart's ability to pump effectively. If you're experiencing palpitations, especially if they're new or changing, you need to see your doctor. Now, here's something really important that I want to emphasize. Sometimes the most dangerous symptom is no symptom at all. Some people can have significant heart disease and feel completely fine. They go for their annual checkup and their doctor detects something on an EKG or an imaging study. This is why preventive healthcare is so critical. You can't always feel when something is wrong. Let me talk about other subtle signs that your heart might be struggling. Erectile dysfunction, and this is primarily relevant for men, can actually be an early warning sign of heart disease. Why? Because the blood vessels in the penis are very small. If they're being affected by atherosclerosis, then the larger vessels in your heart are likely being affected too. So if you're experiencing new or worsening erectile dysfunction, this could be pointing to a heart problem. Swelling in your ankles, feet, or legs is another sign I want you to know about. This happens because your heart isn't pumping efficiently, so fluid backs up into your lower extremities. You might notice that your shoes feel tight by the end of the day, or your socks leave deep indentations in your skin. You might notice that your rings don't fit on your fingers the way they used to. This fluid retention can also manifest as sudden weight gain, like gaining several pounds in just a few days. That's not fat. That's fluid. Nausea or lack of appetite is something that can happen too. Your heart isn't functioning optimally, blood is backing up into your liver, and this can cause nausea or loss of appetite. You might think you have a stomach bug, but it persists. You lose interest in eating, and you feel generally unwell. Difficulty concentrating or brain fog is another sneaky symptom. Your brain needs oxygen-rich blood to function properly. If your heart isn't delivering that blood efficiently, you might notice that you can't focus the way you used to. You forget things more easily. You feel mentally foggy. You might attribute this to stress or aging, but it could be your heart. Now, let's talk about anxiety. Anxiety and heart disease can be connected. Sometimes anxiety is caused by heart disease. Your body is sensing that something is wrong, even if your conscious mind hasn't caught up. Sometimes anxiety symptoms mimic heart disease symptoms, which can be confusing. If you're experiencing new anxiety or panic symptoms, it's worth getting checked out medically. I want to emphasize something crucial here. Symptoms don't always appear in isolation. Most people with heart disease have multiple symptoms happening at once, so you might experience fatigue, shortness of breath, and chest discomfort all together. Or you might have swelling, shortness of breath, and dizziness. The combination is important. Also important to understand is that these symptoms often get worse with exertion and better with rest. This is a key indicator. If you exercise and your symptoms get worse and you rest and they improve, this pattern is significant. It's telling your doctor something important about your heart. But if your symptoms are happening at rest or during minimal activity, that's also concerning. Let me talk about what's actually causing this disease, because understanding the mechanism will help you understand why these symptoms appear. Heart disease develops over years, usually starting in childhood or adolescence, though we don't see symptoms until much later. Various factors contribute to the development of atherosclerosis. Family history is huge. If your parents or siblings had heart disease, you have a higher risk. Age and sex matter. Risk increases with age, and men tend to develop heart disease earlier than women, though that gap closes after women go through menopause. High blood pressure is a major culprit. Persistent high blood pressure damages the lining of your arteries, making them more susceptible to plaque buildup. High cholesterol, particularly high levels of LDL cholesterol, the bad cholesterol, directly contributes to plaque formation. Smoking damages blood vessels throughout your body. Diabetes increases your risk significantly because it affects your blood vessels and your ability to regulate blood sugar, which contributes to inflammation. Sedentary lifestyle is a big one. If you're not moving your body regularly, you're not conditioning your heart, you're not keeping your cardiovascular system healthy. Chronic stress contributes because it increases inflammation throughout your body and keeps your body in a state of heightened alert, which taxes your heart. Poor diet, particularly one high in saturated fats, trans fats, and sodium, directly contributes to plaque buildup and high blood pressure. Obesity is a risk factor because it increases strain on your heart and is associated with many of the other risk factors I mentioned. Sleep apnea is something I want to highlight because many people don't realize they have it. If you're snoring loudly, if people tell you that you stop breathing during sleep, if you wake up gasping, you might have sleep apnea. This condition puts enormous stress on your heart. The inflammatory markers in your body matter too. Inflammation is increasingly recognized as a driver of atherosclerosis. Chronic infections can increase your risk. Even things like chronic stress and depression can increase your risk of heart disease. So understanding these risk factors helps you understand why you might be developing heart disease. And it also points toward how you can help prevent it or slow its progression. Here's what I want you to do if you're concerned about heart disease. First, get to your doctor. Don't put it off. If you're experiencing any of the symptoms I've described, make an appointment. If you haven't had a checkup in a while, make an appointment. Be honest about your symptoms, write them down if you need to. Tell your doctor when they started, how often they happen, what triggers them, what makes them better. Your doctor will likely do some basic tests. They'll check your blood pressure. They'll draw blood to check your cholesterol levels, your blood sugar, and other markers. They might do an EKG, which is a quick, non-invasive test that measures the electrical activity of your heart. If they're concerned, they might recommend further testing like a stress test, where you exercise while your heart is monitored, or imaging studies like a CT scan or an ultrasound of your heart. But here's the preventive side of things, and this is something you can do right now, regardless of whether you have symptoms. You can change your risk profile. You can reduce your risk of developing heart disease or slow its progression if you already have it. Start moving your body. Aim for at least 150 minutes of moderate intensity aerobic activity per week. That could be walking, swimming, cycling, dancing, whatever you enjoy that gets your heart rate up. Strength training twice a week is also beneficial. Your heart is a muscle. You need to exercise it. Pay attention to your diet. Focus on whole foods. Load your plate with vegetables, fruits, whole grains, and lean proteins. Reduce your intake of saturated fats, trans fats, and sodium. Limit sugar. Drink plenty of water. Good nutrition is foundational. If you smoke, quit. I know it's hard. I know people who have struggled with it, but smoking is one of the most damaging things you can do to your cardiovascular system. Quitting is one of the most important things you can do to reduce your risk. Manage your stress. Meditation, deep breathing, yoga, time in nature, time with loved ones. These all matter. Chronic stress is taxing your heart literally and figuratively. Sleep matters. Aim for 7 to 9 hours of quality sleep each night. If you suspect you have sleep apnea, get tested. Get it treated. Maintain a healthy weight. If you're overweight, even losing 5 to 10% of your body weight can significantly improve your heart health. Manage your blood pressure and cholesterol through diet, exercise, and if necessary, medication. These are modifiable risk factors. Limit alcohol. While moderate alcohol consumption might have some protective effects, excessive drinking damages your heart. Stay connected socially. Loneliness and social isolation increase risk of heart disease. Nurture your relationships. If you have diabetes, manage it carefully. Keep your blood sugar controlled. Regular checkups are essential, especially if you have risk factors. Know your numbers, know your blood pressure, know your cholesterol levels, understand your risk. I want to circle back to something I said earlier about silent symptoms. The scariest aspect of heart disease is that you can feel completely fine and still be developing serious disease. This is why a single dramatic symptom or the absence of symptoms doesn't mean you're safe. This is why I'm emphasizing preventive care and regular checkups. Think of heart disease like a house fire. You can have a small fire developing in your walls. You can't see it, you can't feel it, and then one day it breaks through and you realize the house is burning. We want to catch the fire before it breaks through. We want to know about the smoke before there are flames. These checkups, these preventive measures, they're your way of checking for the smoke. Here's something else I want to tell you. If you've been diagnosed with heart disease, you're not alone. Millions of people live with heart disease and live well. The diagnosis is serious, but it's not a death sentence. It's information. It's a wake-up call. It's an opportunity to change the trajectory of your health. If you're prescribed medication, take it as directed. Don't skip doses. Don't decide that you feel better and don't need it anymore. Medications like statins, blood pressure medications, antiplatelet medications, these are saving lives every day. If you have side effects, talk to your doctor about adjusting the dose or trying a different medication. Don't just stop taking it. And if you've had a heart attack or a procedure like stenting, cardiac rehabilitation programs are incredibly valuable. These programs help you recover, help you understand your condition, help you make lifestyle changes. They give you support. Use them. I also want to talk about the emotional aspect of heart disease because it's real. Many people experience depression, anxiety, or grief after a diagnosis. This is normal. These feelings are valid. Seek support. Talk to a therapist. Join a support group. Lean on friends and family. Your mental health is part of your overall health, and it's important. Let me revisit the story of Sarah that I started with. Her symptoms prompted her to see her doctor. The doctor took her concerns seriously. Testing revealed that Sarah had a significant blockage in one of her coronary arteries. She was able to get a stent placed to open up the artery before she had a heart attack. Now she's on medication, she's changed her diet, she's exercising regularly, and she's doing well. Her Her story could have been very different if she had dismissed her symptoms or if her doctor had brushed them off. But because she paid attention and sought help, she got another chance. Your story doesn't have to include a diagnosis. You can prevent heart disease through your choices starting right now. Or if heart disease is already developing in your body, you can slow it, you can manage it, and you can live a full, meaningful life. Here's my final message. Listen to your body. It's constantly communicating with you. Don't dismiss symptoms as just aging or stress or being tired. Get to your doctor. Be proactive about your health. Make the lifestyle changes that reduce your risk. Take medications if they're prescribed. Get regular checkups. Know your risk factors. Understand your family history. Your heart has been beating for every moment of your life. It's one of the most vital organs you have. It deserves your attention and your care. The silent symptoms of heart disease don't have to be silent if you know what to listen for. Thank you so much for watching. If this information was helpful, please like this video and subscribe to the channel so you don't miss future health education content. Leave a comment below if you have questions or if you'd like me to cover another health topic. And please, if you're experiencing any of the symptoms we discussed today, don't wait. Reach out to your healthcare provider. Your heart is worth it. Take care, and remember, your health is your wealth.